Imagine a world without water and sanitation. A world where something as simple as drinking water is not guaranteed. Life as we know it would be unimaginable. For many years, governments across the world have worked tirelessly to bring water and sanitation services closer to the people they serve. Yet, significant gaps remain. Rwanda is among the countries that have made significant progress in expanding water, sanitation, and hygiene services, also known as WASH. According to the 2025 Integrated Household Living Conditions Survey, EICV7, by the National Institute of Statistics of Rwanda, 89.7% of the population now accesses safe drinking water, and 94.3% of households use safely managed sanitation facilities.
When I started with this vision, it was not only the vision for the water and sanitation, it's the whole vision for the country. So through what we call an institute, from 2024 to 2029. And also as the water and sanitation sector, we had to set our strategic plan to accelerate the progress toward the universal access, reliable and sustainable wash services.
Despite Rwanda's ambitious goal of achieving universal access to water, sanitation, and hygiene services by 2029, important challenges remain that continue to hinder progress toward this target.
There are many pressing challenges to achieve universal access to water in Rwanda, but I will just highlight a few of those. The first one is the aging infrastructure. And these need to be continuously rehabilitated, which requires a lot of investment. The second one is related to climate change, whereby floods are washing away the pipes, and also some of the treatment plants get flooded. And this affects production of water, but also distribution, supply and distribution of the water. The third one is non-revenue water, which is basically the water that we produce and we expect it to be consumed by the people, but of course people don't use it, and so we lose it on the way, and that is also affecting the water supply. There is also an issue of growing population, and as the population grows, it puts pressure on the systems that we have. But also it puts pressure on the water as a resource.
To support the country in addressing these challenges, Water for People, together with IRC WASH, CARE International, VEI, and AEE, with funding from the US government, implemented the Isoko project in close collaboration with government institutions. The project aimed to strengthen the delivery of safe, reliable, and sustainable water, sanitation, and hygiene services across targeted communities.
Initially, we started in 10 districts. We started with Nyagatare, Kayonza, Rwamagana, Ngoma, Kirehe in the Eastern Province, and also Nyamagabe, Buhango, Nyanza in the Southern Province, and Nyabihu and Gororo in the Western Province. We started in July 2021, and the project will be completed in July 2026. We started with 3 strategic objectives. The first one was improving wash governance. The second is improving access to drinking water services. And the third one is improving access to hygiene and sanitation products. However, in 2024, when there was a Marburg virus outbreak in Rwanda, the US government gave us additional $1 million funding to support the government of Rwanda in handling the Marburg virus.
Isoko was a project through IRC worked with different partners, including Minefra, WASAC, Rura, Roda, and the ASERWA to intervene in the area aiming at the improvement of decentralized wash governance, focusing mainly on the national sector institutional strengthening, as well as improvement of district capacity to implement a wash policy and plan.
Water for People and IRC partner with the Rwandan government to deploy the Wash Systems Academy. This online platform provides specialized courses to strengthen local and national water, sanitation, and hygiene wash systems.
We are trained to different organizations in wash sector, including WASAC, but also even staff from the Ministry of Infrastructure. And myself, I was one of the beneficiaries of the Wash System Academy. Isoko Ubuzima also facilitated exchange learning visit whereby government officials from WASAC participated to the exchange learning visit in India, in one of the provinces that was successful in terms of, addressing component of non-revenue water, management of utilities, and so on.
District wash investment plans are comprehensive, data-driven roadmaps designed to achieve 100% sustainable coverage for water, sanitation, and hygiene, wash across an entire district.
Ubu hari abafatanyabikorwa bari kugenda bakoresha iriya investment plan bakaduha amazi. Nk'umushinga twakoranye n'abandi bafatanyabikorwa muri Nasho Water Aid bahereye ku byo umushinga Isoko y'Ubuzima ari warakoze muri investment plan. Bivuze ngo rero twebwe dufite igikoresho cyafasha akarere kudatungurwa igihe habonetse ingengo y'imari. Igikoresho cyadufasha kudatungurwa igihe umufatanyabikorwa uvuze ati ndashaka kubafasha gukora ibikorwa ibi n'ibi mu by'amazi.
A strong wash system goes beyond governance alone. It also depends on the functional infrastructure that delivers services reliably to communities. Through the Isoko y'Ubuzima project, non-functioning water supply systems were rehabilitated and maintained, helping to reduce inefficiencies such as non-revenue water, which is water that is produced but never built. These improvements helped ensure that water systems continue to function sustainably for the communities that depend on them.
Babonye ko uno musozi tubona amazi tugoye, leta idushakira abaterankunga, hanyuma tubona baraje bacukuye imiyoboro, tubonye amazi. Ubu rero sibyo no kuba twajya kuvoma ku mugezi rusange no mu ngo turayafite.
The customer management systems for Isoko y'Ubuzima project is a digital platform designed to improve water service delivery, streamline billing, and enhance customer management for rural water supply operators across Rwanda, developed with the support of the government of Rwanda.
On the side of rural, it's a tool, a digital tool that is helping us actually directly tap into what the private operators are doing in terms of extension, new extension that they are adding in their daily operations, billing, and new stock, and any other financial activity that they are doing. And this is helping us to, in real times, monitor what they do in terms of financial management.
Water alone is not enough. For communities to live healthy, dignified lives, safe sanitation and good hygiene must go hand in hand with reliable water services. Without them, families remain exposed to preventable diseases that affect health, education, and livelihoods. Recognizing this link, the Isoko y'Ubuzima project also invested in strengthening sanitation and hygiene services, supporting households and communities to build cleaner environments and adopting safer practices that protect health and well-being.
For the market-based sanitation used under Isoko y'Ubuzima, we developed a strategy which was combining both the market-based or market concept, but also social behavior concept.
Nkorera kuri sanitation center ya Rwamagana, aho ducuruza ibikoresho by'amasuku n'isukura, tukigisha abaturage uko barushaho kunoza isuku n'isukura amago yabo, ubwo tubinyuza amahugurwa. Ikindi no kubakira abaturage toilet cyane cyane za satopari, ariko tuzibakira babanje kuzigura ahangaha, tukabigisha no kuntu bagomba kuzubaka. Bimwe mu bikoresho by'isuku n'isukura wasanga mu kigo cy'isuku n'isukura ni byinshi. Uhasanga satopani, uhasanga toilet papers, uhasanga amarange, uhasanga raclette, uhasanga hand wash, vimu, uhasanga pads z'abakobwa, ukahasanga toilet brush, ukahasanga kandagira ukarabe, mbese buri gikoresho kijyanye n'isuku n'isukura iwacu kirahari.
Aho mfite toilette itanshimisha neza, itindishije ibiti ku muryango waho, hakingishije umwenda, iza gutinda rero njya ahantu nkabona kariya ka supapani, habonye numva karanshimishije cyane, ntekereza ukuntu nzakabona, numva ni ibintu bikaze cyane. Ubwo noneho emerita uyu nguyu tukaba tubana mu itsinda, adukangurira, atwigisha ibyiza bya kariya gakoresho, arabitubwira, kubitana nuko nakabonye, mbona karanshimishije, numva ndagakunze. Ubwo byagenze gute, abo tubana mu itsinda amaze kutwigisha twumvishije, abumvishije bagashaka bahise batumutuma aratuzanira, mpita nkagura. Mpumeka amaze kubona umutekinisiye wigiye kubaka turiya dutuwarete, najyagamo nkumva mfite ubwoba, ntajyanamo na telefoni yanjye, ariko ubu ngubu ni ukuri waza singira ipfunwe ryo kukoherezamo nawe, nanjye njyamo, nabonye akanya njyamo na telefoni yanjye nta kibazo mfite, nkicara rwose nkiganira n'abana banjye, tugacata bimeze neza.
Poor sanitation not only affects the comfort and dignity of people, it creates pathways for disease to spread. In communities where clean water is insufficient or difficult to access, and hygiene facilities are inadequate, outbreaks can escalate quickly and threaten lives. The importance of strong wash services became even more evident during public health emergencies such as COVID-19 and the Marburg virus disease outbreak. To help communities stay safer and more resilient, the Isoko y'ubuzima project partnered with the Ministry of Health to draw interventions that strengthen prevention against any future shock.
Minisiteri y'ubuzima ku bufatanye bw'Isoko y'ubuzima nk'abafatanyabikorwa baduhaye amahugurwa, babanjirije hano mu bitaro bya Kibagabaga mu maserivisi atandukanye, hagiye havamo abantu bayahagarariye, baraza babigisha igihe cy'icyumweru cyose. Ayo mahugurwa yagiye bavuga ku bintu bitandukanye bijyanye na kwirinda indwara zishobora kwandura, haba mu mwuka, haba mu gukoranaho. Bakoze cascade cyangwa bakoze bagenda bigisha bamwe, abandi nabo bakigisha abandi, abandi nabo bakigisha abandi, mu buryo twageze no mu bigo nderabuzima, aho twagiye duhamagara abantu babiri kuri buri kigo nderabuzima, ndetse tuvaho tujya no mu bigenga, icyo bita poste de santé, nabo turabigisha. Cyane cyane twibandaga ukuntu dushobora gutandukanya imyanda yo kwa muganga, uko dukaraba intoki neza, haba ugiye gukora ku murwayi, haba umuvuyeho ugiye ku wundi. Bigisha uko basukura ibikoresho byo kwa muganga, uko babisteriliza, bigisha abantu uko amashuka abarwayi baryamaho, uko ava muri serivisi akajya ku imesero, n'ukuntu ava ku imesero agaruka mu maserivisi. Bigisha abantu kwambara imyenda y'ubwirinzi, ndetse no gutegura ahantu heza ho kuvurira umurwayi, ndetse n'igihe umurwayi baba bamukekaho indwara yanduza, uko yavanwa muri serivisi akajyanwa muri isolation, ndetse n'abaganga bamusangayo uko bagomba kuba bambaye, no gusohoka uko bambara imyenda, uko bayikuramo, kugira ngo nabo batiyanduza ubwabo.
By focusing on prevention rather than emergency response, the project helped transform lessons from Marburg outbreak into lasting system and behavior.
You can't say IPC without wash. IPC and wash, I can say it is a sister and brother. Without wash, IPC cannot work. We need wash to apply IPC. We need the water. We need the sanitation. We need the hygiene services.
Through strong partnerships with the government, communities, and private sector actors, the Isoko y'ubuzima project delivered tangible results that continue to improve lives across Rwanda. Development of 10 district wash investment plans to mobilize resources and accelerate progress. Capacity building for 540 plus wash professionals via the customized Wash Systems Academy. Infrastructure rehabilitation providing 369,000 plus people with reliable water services. Water efficiency improvements, reducing non-revenue water and generating 166 million RWF in returns. Expansion of sanitation services reaching over 119,000 people. Strengthening of healthcare facilities through infrastructure support and training for 2,600 plus frontline workers.
Ibyo rero tubona twagumana kugira ngo ibikorwa bibungabungwe, icyambere ziriya komite zahuguwe, ziriya komite zigomba kuba zikora ariko tukazikurikirana nk'ubuyobozi, noneho tukazishyira no muri gahunda yacu. Buri mwaka hari igikorwa dukora no muri kiba no mu mihigo cyo gukurikirana isuku n'isukura. Tuzakorana na ziriya komite kugira ngo zidatakaza inshingano, zikomeze zikurikirane biriya bikorwa. Ariko nanone hakaza muri ikindi cyo kuvuga ngo abaturage ibi bikorwa babigira ibyabo, bifate mu maboko, yaba gucunga imiyoboro y'amazi yubatswe, ibigega by'amazi, yaba gukurikirana amasoko yatunganijwe hano hafi y'umujyi twari tuyikeneye cyane, ariko ugahita ubona abaturage babonye amazi.
Wash is life.
Wash is a system.
Wash for me is dignity.
Wash is health.
Wash is life.